thank Doug, Councillor Evans, for inviting me today to speak, because of course I'm not the expert on mental health in this room. I feel a bit humble actually, surrounded by lots of people who know far more about mental health and emotional well-being of children, so I hope to learn an awful lot tonight. But I suppose what I do want to say is it's important to me in my position, both as a GP, I've been a GP for over 20 years, and as chair of Bromley CCG. So I suppose this is part of the perspective that I understand and we understand in the CCG about what's happening in Bromley. And of course the fantastic thing is that we're getting together here this evening to be able to talk and discuss this and share what we all know and what our experience is. And I spent yesterday afternoon with a large group of GPs who were all learning about emotional well-being, about the services in Bromley. It was great because part of that session was led by one of our voluntary sector organisations that Valerie alluded to, which is Bromley Y, who now deliver our single point of access wellbeing service. And it's worth, this is something I learnt yesterday, that the importance of helping children that early developmental stage is that 50% of adult mental health problems probably start by the age of 14, 75% by the age of 18. So if we can intervene and do things and change that in developing brains, if you like, that's going to be so important. And of course that's why this is one of the key priorities on the Health and Wellbeing Board strategy. So of course, as has already been mentioned, we have a great service now in Bromley which is helping us establish a kind of consistent way of helping children. And we've got a single point of access for our emotional mental health through the Bromley Community Wellbeing Service. And that allows self-referrals by young people, referrals from GPs, which is probably the largest source of referrals at the moment, but parents and other professionals can also send children in that direction. And after an assessment and brief intervention is provided, then many children are helped and can be moved on, but also referral into other services is possible. So if we just have a little look at the actual service itself, and I think one of the great things is it shows you how many different agencies can be involved in this. So the idea is that wherever children might be presenting with the features of their difficulties, then they can be directed into the single point of access, and so we can get a consistent approach to helping children. And I know from what I heard yesterday, the service is very busy. It's getting about 20 to 30 referrals a day. Referrals have gone above 3,000 now since it started. The great thing is they get 92% of children attending. That's probably better than most services. And that's something to do with the accessibility and making children welcome there. And of course, we're trying to help improve this from our point of view in the CCG by we've established a secure NHS email, so that's going to help the referrals from GPs as well. Of course, onward referral into more specialist services is possible, but also other services that might be useful to children. So if we think a little bit about the population, just under a quarter of our population are children and young people, and about just under 1 in 10 of those will suffer with some form of emotional well-being, which is probably what we might expect from a national point of view. So thinking a little bit more about Bromley, one of the things, and I want to draw attention to this, is that unfortunately we do have a high rate of children visiting A&E due to self-harm. And this is data that's collected nationally through the Child and Maternal Health Intelligence Network, or CHIMAT. And figures are probably higher than those in other areas of London. And it's estimated about a third of those locally were probably known to children and adolescent mental health services. The rates that were published for 2013-14 was slightly higher than London, although I was stopped by one of our public health consultants on the way and saying new figures have just been published, 14-15. I'm afraid they're not better, they're slightly worse. So we've got about 270 per thousand compared to about 200 in London. We did see higher admissions with substance misuse and alcohol, fewer with alcohol compared to London. Difficult, they're smaller numbers, so we're not quite sure whether that really shows a particular trend or not. We also have what you might term a cluster around people needing help with eating disorders compared to some of our neighbouring CCGs. So we have higher activity, and that's not always understood exactly why that is, but again, we're working very closely with our provider of eating disorder services at SLAM to understand about that and to improve services. We've had nearly 3,000 referrals now into the wellbeing service, and although there are high levels of emotional and mental health needs, perhaps that wasn't expected and shows that one, we're finding out about what children's needs are now, and we're also able to, if you like, understand the need in our community. And of course there are many different issues that children are presenting with. The other interesting fact is that it's roughly correct in terms of the ethnic minority presentation, and we need to keep an eye on that, because what we wouldn't want to see is some parts of the population not accessing services they should do. So we'll keep monitoring that. In terms of the issues that children are presenting with, then the commonest ones are anxiety and low mood, but there are other problems like stress, bullying, bereavement, difficulty with low self-esteem, issues that arise in school, but also issues that arise from relationship difficulties. And of course, 15% of young people in contact with the service were able to admit that they were self-harming. But over 12% had thought or planned suicide, and 3% of children had a history of attempting suicide, which is quite startling, and I think is something that we need to dwell on and think about and reflect on. 1 in 5 children referred into the service had a parent with mental health issues, and this shows the importance of services working together, because obviously parents might be linked into other adult services. And a third of the referrals identified that they had problems in family relationships. So what are we doing? Well, we've been fortunate to benefit from increased funding that we could put into some of the services locally. I think the important thing is trying to work together, so working across with the local authority through mental health services, our CAMS services, the voluntary sector, education, carers, parents. And I think we've got a transformation plan that we've just started the first year. We've tried to increase the capacity. We've identified some gaps in services that we're trying to improve. We're hoping to put more input into schools, and we've got to hopefully develop our plans, and the opportunity to discuss this evening is really important, and we hope to gain from that discussion. And in fact, I met Colin McLean on the way in here. He had to leave early, but he was saying that he felt that we had certainly, as a CCG, moved our relationship with the voluntary sector on in the last year, and we want to grow that further. One thing that's worth noting, of course, is that children don't communicate like we adults do, and so certainly for GPs we've been trying to encourage them to look at some of the digital resources that are out there. And there are some useful resources that can help young people in preparation for a visit to talk to a professional. So one of them is the CAMS Ready, which gives them information, advice, helps them create a list to talk about their problems. Whereas Oxley's has developed a useful interactive website called Headscape that children can go on, and it helps them do self-questionnaires and prepare for visits. And the other one that I learnt about yesterday, which was really for professionals and carers and parents, is Mind Ed. And you can go on there, you can do a kind of little learning course and improve your own knowledge and education. So I think we want to really try and keep the momentum going with this. And I think it's really important that we understand our children and young people better and how they communicate, and certainly as a doctor I'm always finding out more and more about that. And as a parent, I was interested to know that my teenager only has half the vocabulary that he's going to have when he's 25. So his yes and no answers are because those are the only words he's got sometimes for the ridiculously complicated questions I ask him. So I've got to come down a bit and try and communicate better. So I hope that I've managed to communicate some of the important points this evening, but I'm really looking forward to finding out from all of you what you understand and know about mental health problems. Thank you.